Medication orders are an essential part of providing medical care to our patients. A medication order is given by a provider, like a physician, a physician's assistant, or nurse practitioner, to a nurse, like an RN or an LPN. There are 7 essential components of a medication order. So here we have a sample medication order written on August 6, 1928 at 12:30 for patient Jane Smith. Medication penicillin VK 500 milligrams by mouth every 12 hours, signed by the physician Alexander Fleming. First, we have the date and time, the patient's name, the name of the drug, the dose of the drug, the route of medication delivery, and the frequency the medications to be delivered, and then the signature. And this may be electronic, as most orders in this day and age are electronic. There are other components that may be added to medication orders, including parameters for delivery. As some examples, hold for a systolic blood pressure less than 90 millimeters mercury, or indicated for pain rated greater than 5. Sometimes medication duration is added to an order, as an antibiotic may be given for maybe 5 days, or for a total of 6 doses, as a couple of examples. Here is the previous medication order example, and we've added on another one here with some differences. So here we see that we have insulin glargine, 12 units subcutaneous every morning. So this has a different drug, a different dose, a different route, and a different frequency for the order. Regardless, both these orders have 7 essential components of a medication order that make them valid. A nurse cannot accept an order that does not have all 7 components and must seek some sort of clarification to fulfill all the necessary components. Medication rights are also an essential component of medication delivery. So we have to make sure that we give the medication to the right patient, and we have to check 2 identifiers to make sure that we have the right patient. This might be name, birth date, or medical record number. We also have to ensure that we have the right medication. We have to be careful because some medications sound similar when spoken, and some look similar when we see them on paper or screen. We want to make sure that we are delivering the right dose. So sometimes this necessitates the nurse doing some medication math to ensure that we are giving the right medication to the right patient at the right dose. Of course, we also want to make sure that we give the medication by the ordered route. So this might be an injection, whether it be IV, IM, subcutaneous, or it could be a pill the patient takes by mouth. We want to give the medication at the right time. Generally, in the acute care setting or long-term care setting, the guidelines state to give the medication within an hour of its ordered time. So a medication that's for 9 a.m. could be given from 8 a.m. to 10 a.m. to fulfill the requirements of being given at the right time. Some other medication rights that are not the core 5 that were originally conceived of, but can also be very important for making sure that the nurse does all the components of medication delivery correctly, is we want to give the right documentation in the medical record for the medication. We want to make sure that we provide patient education on the medication as needed. We want to make sure they understand what medication they're receiving, why they're receiving it, possible adverse reactions to look for, anything that the patient would need to know for the medication that they're getting, and answer any questions that they have. We Must also be cognizant that the patients have a right to refuse any medications. It is, after all, their body, and we are providing care in cooperation with the patient, not in charge of the patient. Many medications require us to collect data to make sure that the medication is safe to provide and doesn't cause unnecessary adverse reactions. So we want to make sure we're providing assessments maybe before, shortly after, or at any time that's necessary related to a medication. And related to this, we want to evaluate the effects of the medication. Both therapeutic, is the medication doing what we want it to do, what we need it to do, and also for adverse effects. A medication error occurs when we violate the rights of medication administration. So this would be the wrong patient, the wrong medication, wrong dose, route, or time. We need to ensure that we are following the 5 rights of medication administration for our patients. We can also run into problems if we violate any of the other rights of medication administration, but that will be very context specific. How do we prevent future errors? Well, we make sure that our medication knowledge is as high as we can make it. We want to understand why we're giving the medicine, what the medicine can do, and we want to understand the disease that the medication is related to. This helps us understand the signs and symptoms of the patient, the adverse effects of the medication, and how to best monitor for the therapeutic effects of the medication. When we supply medications to our patients, we should do one patient at a time. It can get very confusing, especially if things get busy or the unexpected occurs during a shift. We want to reduce distractions while both collecting the medications and delivering the medications to the patient. In all, we want to be intentional and deliberate when we are passing medications to our patient.